The silent threat. Erectile dysfunction may be more dangerous than you think. Erectile dysfunction, ED, is a condition that affects millions of men worldwide, yet few openly talk about it. For many, the mere thought of being unable to maintain a firm enough erection for sexual intercourse can trigger feelings of anxiety, shame, and even despair. However, ignoring this issue could be a fatal mistake, as erectile dysfunction may be a warning sign of more serious health problems. What is erectile dysfunction? Erectile dysfunction refers to the persistent inability to achieve or maintain an erection sufficient for sexual activity. It's important to understand that occasional impotence is not uncommon. Almost all men experience it at some point. However, when the problem becomes recurrent, it can indicate an underlying condition that needs medical attention. What causes erectile dysfunction? Several factors can contribute to erectile dysfunction, and the causes can be both physical and psychological. Some of the most common physical causes include cardiovascular diseases. Erectile dysfunction can be an early indicator of heart problems, such as atherosclerosis, high blood pressure, and high cholesterol. Diabetes. Men with diabetes have a significantly higher risk of developing impotence since the disease can damage the nerves and blood vessels responsible for erections. Obesity. Excess weight is linked to hormonal and cardiovascular issues, increasing the likelihood of erectile dysfunction. Smoking and alcohol. Excessive consumption of alcohol and tobacco can impair blood flow and nerves, directly affecting erectile function. Certain medications. Some drugs used to treat high blood pressure, depression, and other conditions may have erectile dysfunction as a side effect. On the other hand, psychological factors also play a significant role. Stress, anxiety, depression, and relationship problems can all interfere with a man's ability to maintain an erection. Symptoms of erectile dysfunction. The most obvious signs of erectile dysfunction include difficulty in achieving or maintaining an erection during sexual activity, erections that are less firm or don't last as long, a loss of interest in sex, often related to the emotional stress caused by the inability to have an erection. Additionally, men who suffer from erectile dysfunction may experience low self-esteem, feelings of inadequacy, and even depression. Consequences of not treating erectile dysfunction. Leaving erectile dysfunction untreated can have serious consequences, both physically and emotionally. Without proper treatment, the condition can lead to relationship problems. Impotence can create emotional and physical distance between partners, increasing tension and contributing to marital or relationship crises. Low self-esteem. The inability to maintain an erection can deeply affect a man's confidence, leading to feelings of inadequacy and even social isolation. More severe health issues. As mentioned earlier, erectile dysfunction can be a sign of underlying conditions like heart disease or diabetes. Ignoring these signs may delay the diagnosis and treatment of potentially life-threatening conditions. Depression. Prolonged, untreated impotence can contribute to the development of depressive disorders, further complicating the situation. Diagnosis. Tests to detect erectile dysfunction. Diagnosing erectile dysfunction begins with a detailed medical evaluation. Your doctor may request the following tests. 1. Physical exam. This includes assessing the cardiovascular system, measuring blood pressure, and examining the genitals for any physical abnormalities. 2. Blood tests. These tests check hormone levels, like testosterone, blood sugar levels, to detect diabetes, and cholesterol levels. 3. Penile ultrasound. This test evaluates blood flow in the penis and can help detect any vascular problems. 4. Psychological assessment. To identify possible emotional or psychological causes of erectile dysfunction, such as depression or anxiety. Treatments and medications for erectile dysfunction. Fortunately, there are several treatment options for erectile dysfunction, which can be tailored depending on the underlying cause. Treatments include 1. Lifestyle changes. Quitting smoking, reducing alcohol consumption, losing weight, and adopting a healthy diet are key to improving overall health and erectile function. 2. Oral medications. Drugs like sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra, are commonly used to treat erectile dysfunction. These medications help increase blood flow to the penis, making it easier to achieve an erection when sexually aroused. 3. Hormone therapy. If erectile dysfunction is caused by low testosterone levels, your doctor may recommend hormone replacement therapy. 4. Vacuum devices. These devices create a vacuum around the penis, increasing blood flow and helping the man achieve an erection. 5. Surgery. In more severe cases where other therapies have not been effective, surgical procedures such as penile implants may be recommended. 6. Psychological therapy. If impotence has emotional causes, psychotherapy sessions, often involving the partner, can help address the problem. Conclusion. Erectile dysfunction is a serious issue that can impact not only a man's sexual life, but also his emotional and physical health. Ignoring the signs can be dangerous, as it not only affects relationships and self-esteem, but may also indicate more significant health issues. Early diagnosis and proper treatment are essential to ensuring a satisfying and healthy sexual life.